Hi, my name is Emily and I'm very excited to welcome you to this basic life support course. This course is full of knowledge and useful first aid information for all the family. Learning first aid is a must for all. By learning these vital life-saving first aid skills, you can make a difference to someone's life. Now we're going to be talking about how to treat adults, children and babies. And we're going to be looking at what to do if someone's unconscious and they're breathing, so recovery positions. What to do if they're unconscious and not breathing, so CPR and the use of the AED. So without further ado, let's get on and start the course. So we're going to start off with an unconscious casualty who is breathing. Now I want to make this as practical as possible for you, so I'd like you to join in as we're going through some of the theoretical bits. So what you need for this is maybe a cushion on the floor, a teddy on the floor, or maybe you've got a helper at home that could be your casualty. Because we're going to imagine that we've got somebody unconscious on the floor. And we're going to put the primary survey together with the secondary survey together with the recovery position. The primary survey is when we check the area for danger. We look, listen and we smell for things that could be dangerous for us. We're then checking for response. If there's no response, we shout for help. We then open the person's airway and then we look, listen and feel for breathing for 10 seconds. So that's our primary survey. Then the secondary survey is when we do the head to toe check. And then the recovery position is the position we put them in order to maintain an airway so they're not going to choke on their own vomit, saliva, and it allows the airway to stay open. So that's the theoretical bits we are going to put into our practice situation. Okay, so the very first thing we're going to do then is there's a casualty on the floor. We've walked into the room, we're checking the air for danger, we're looking, we're listening, we're smelling for things that are dangerous, such as fire, other people being there, things that have fallen down, things that are touching them. We make it safe if needed. We talk to the casualty to see if they're awake. If they don't respond to my voice, I'm going to push on their shoulders gently to see if I can get a response, or maybe make a loud noise. They're not responding to me. Now I'm going to shout for a helper, because I want a helper to get me a first aid kit, especially if I'm in a workplace. Now, if I was in a workplace, this is when I would put my gloves and PPE on. In this example I'm showing you, I'm in a home situation, but in a workplace, please put your appropriate PPE on. I'm then going to open the airway by doing a chin lift and a head tilt. So one hand on the forehead, two fingers on the chin, and pushing the forehead back and lifting the chin up. I'm getting nice and low to this casualty. And I'm looking and I'm listening and I'm feeling for normal breathing. So I'm feeling with my cheek, I'm listening with my ear, and I'm looking at their belly or their torso rising and falling. And I'm checking for 10 seconds. Now if someone was breathing normally, an adult will breathe between 2 and 4 times if they were breathing normally in 10 seconds. If you're doing this on a baby will be breathing 10 times in 10 seconds. Now it's really important to check for normal breathing, because if someone has something called agonal gasps, which someone goes, this can be the last breath that someone breathes. And actually they might need CPR performed to them. So please check for normal breathing for 10 seconds. Great news, the person is breathing normally. So then what we're going to do is do our secondary survey. We go from the head all the way down to the toes, and we're looking for anything such as bleeding or broken bones, or anything that can explain why this person is injured. So we're checking the head for any lumps and bumps, looking for fluid coming out of their ears. If they've got fluid coming out of their ears, it could indicate spinal issues. Looking to see if they've got those medical ID necklaces on. We then look down one arm at a time. I'd roll up the sleeves, have a look for lacerations and also bracelets. I'll do the same on the other arm. I will then check the torso to make sure the sternum is okay, make sure that the belly, there's no hard bits on the belly. If there was, it could indicate internal bleeding. I gently push on the pelvis to make sure it's still intact. Then I use my back of my hands to see if there's anything in the pockets. The reason I use the back of my hands is because if they did have something sharp in the pocket, I'm more likely to grab it if I went palm down, and therefore I might hurt myself. And then I check one leg out at a time. So that's the primary survey, then the secondary survey. Then, now I've found no injuries with this casualty, I'm going to place them into the recovery position. Now I do this by putting both my arms on the other side of the patient, so I lean over. The hand closest to the casualty's head, I'm going to link fingers with them, and I'm going to gently bring it across their body and slap their cheek closest to me, but I'm still holding my hand in place. I won't let go, because if I did let go, the hand will just flop back down again. So I hold it in place. With my other arm, I lift the outside of their leg, lift the knee up, and push their shin and their foot towards their bottom. And then all I simply need to do is use one finger or very gently push their knee towards me, and they will roll over on their side. I need to make sure the knee is at 90 degrees in order to make sure they stay on their side, and then I open their airway. And the reason they're on their side is because it's allowing the airway to remain clear. If they're sick or they've got any vomit or blood in their mouth, it's just going to drain away. I'm going to keep checking and monitoring their breathing while they're in this position. And if it hasn't been called already, I would now call the ambulance. Now, we put them in the recovery position because it allows them to maintain an open airway. And that's really important, to have an open airway. However, if we find they've got a broken leg or a broken arm, or we forget how to do the recovery position, then what are we going to do? Well, we kind of do the same thing. We maintain an open airway. So that means they stay on their back and we just keep their airway open. The downside of this, however, is that my hands are now attached to that casualty. So that's great if I can be with that casualty all the time, and there's lots of other helpers around, and the other helpers can go and open the front door for me and bring the ambulance crew to me. But if I'm by myself with this casualty in the home, at some point I need to open the front door for the ambulance crew. So ideally I need them in the recovery position, because if I let go of the casualty's airway, it will close again. And that's when the airway could be blocked and they might stop breathing. So what I want you to do is go and pause me, and I want you to practice that either with a cushion on the floor or with somebody else. The primary survey, the secondary survey, and the recovery position. Or go and practice putting yourself in that position. And try doing it on both sides. Don't just do it on one side. Go on, pause me and go and practice. I'll be here when you come back. Okay, so we've looked at what to do if the casualty is breathing, but now let's have a look at what to do if the casualty isn't breathing. So we've done our primary survey and we found out they are not breathing. We're going to learn about what CPR is and the importance of the chain of survival. So CPR then stands for cardiopulmonary resuscitation. You need to perform CPR when someone isn't breathing normally. Because by doing CPR, what you're trying to do is you're trying to pump the heart. If you pump the heart, you're pumping blood around the body, and inside blood there's oxygen. You're trying to keep them alive or bring them back to life until medical professionals can take over. Now, the chain of survival concept is designed to show you your role in an emergency procedure. Following each link in the chain in the correct order can greatly increase the person's chances of survival. So there are 4 links in the chain. First one is early access or early activation of the emergency services. So call the emergency services as soon as possible, as soon as you know that person isn't breathing normally. The next link in this chain of survival is beginning CPR, early CPR. Without effective CPR, it is probable that the next links in this chain are not going to work. So early CPR is crucial. The next link in the chain is early defibrillation, using an AED. So if you have access to an automated external defibrillator, then you need to use it. The quicker you get one there to the patient, the better that person has of surviving. What an AED actually does, it interrupts the abnormal twitching of the heart, and it can reset the heart so it begins beating normally again. We'll talk more about that in a later video. Then the final link in this chain is early advanced care. Now this is given by the emergency services. In addition to delivering an AED, they will also have drugs and oxygen and other equipment, and are actually trained to provide care that is far beyond first aid. But every link in that chain is vital. If that chain of survival is broken at any point, then that patient's chance of survival is massively reduced. So if you don't call the emergency medical services quickly, this will delay the advanced care and possibly the AED. If you don't provide CPR, then the effectiveness of using an AED and advanced care are compromised. So every link is important. And in fact, for every minute of delay between the person going into cardiac arrest to the time when an AED arrives at the scene to when advanced care can be given, the chance of survival drops by 10%. Making sure that their links remain intact and that an AED is available at the earliest possible moment improves that person's chance of survival. So make sure those links are not broken. So let's put this into practice, shall we? Now, do you remember the primary survey, danger, response, airway, breathing? Well, we're going to be adding a C and a D onto the end of it. C for CPR and D for defibrillation. So D for danger, R for response, A for opening the airway, B for look, listen and feel for breathing for 10 seconds. And if they're not breathing, we need to call the ambulance, and then we need to do C for CPR and D for early defibrillation. Check the air for danger. Hi, can you hear me? Wakey wakey, rise and shine. No response, help! Gonna open your airway. We're gonna look, listen and feel for breathing for 10 seconds. 2, 3, 4, 5, 6, 7, 8, 9, 10. You're not breathing. I'm going to call 999. Got an unconscious adult not breathing. I'm asking for a defibrillator. Gonna remove your clothing. 2, 28, 29, 30. And then we're going to keep on going until the ambulance turns up. So that was the whole thing you've just watched. So we're going to break it down to make it a little bit easier and simpler to follow. And this is when you can grab your cushion or teddy so you can practice as you're watching the video. So the first thing we're going to do is check the area for danger. So we're looking, we're listening and we're smelling for anything that could be dangerous. So you notice when I approach a casualty, I approach them from their feet. And that's because if he's got a spinal injury, your eyes are naturally looking in front of you. They're not looking behind. And if he was conscious, you don't want them moving that neck and making that spinal injury worse. So always try and approach them from their feet if you can. And then check the response by talking to them. So hello, no response. So now I'm going to see if they respond to a bit of pressure. I'm going to just push on their collarbone or squeeze their shoulders. Might even make a big loud noise to see if they blink. No response. Shouting for help. Help! And then when I open the airway, I then put 2 fingers underneath the chin, 1 hand on the forehead, and I did a chin lift and the head tilt, and I kept my hands there. Because if I don't keep my hands there, what will happen is the airway will close. So chin lift, head tilt, keep my hands there, and then I got nice and low, and I look at their belly, I listen with my ear, and I'm feeling on my cheek for normal breaths, and I'm doing this for 10 seconds. Now remember, an adult is going to be breathing normally between 2 and 4 times in those 10 seconds. If they're not breathing, which is casualty isn't, I must leave my casualty and I must call the ambulance, because the sooner I get them there, the better this person has of survival. And then when I return, making sure I'm asking for a defibrillator as well, I will come back and do compressions. I'm going to place the heel of my hand on the centre of the chest. I try and get my middle finger in line with the nipples. So I'm right on the sternum, middle finger in line with the nipples. Now I won't be able to push down deep enough if I'm sitting like this. So I'm going to get my shoulder over the top of my wrist, move my knees back, and other hand will go over the top. And I might even want to link it together like so, or just place it like that. And then I'm going to push down 5 to 6 centimetres in depth, making sure when I push down, I also come back up. Imagine this is your heart. As you're pushing down on the heart, you must allow the heart to refill, so you must come back up again. So you push and you come back up, push, come back up. So here, push, come back up, push. And I'm going to go at the speed of 100 to 120 beats per minute. You can sing yourself a little song if you like to as well. But I'm going to do 30 of them. And after I've done 30, I will then go to my rescue breaths. So same as before, 2 fingers under the chin, 1 hand on the forehead. We do a chin lift and a head tilt. This time I'm going to pinch the nose, open its mouth, keeping this airway open, otherwise nothing will work if it's like that. And I'm going to open my mouth, look away, and back on that chest again. It should only take me 5 seconds to give those 2 breaths. And then I'll just keep on going until someone else will take over from me, until they come back to life, or until I can't carry on anymore. Shut the air for danger. Hi, are you okay down there? Can you hear me? Wakey, wakey, rise and shine. Help! Open the airway. Let the sun feel for breathing for 10 seconds. 6, 7, 8, 9, 10. You're not breathing. 1, 2, 3, 4, 5. Seven, 28, 29, 30. 1, 2. 26, 27, 28, 29, 30. 1, 2. 28, 29, 30. No, we've got an unconscious child not breathing. So that was the whole thing you've just watched. So we're going to break it down to make it a little bit easier and simpler to follow. And this is when you can grab your cushion or teddy so you can practice as you're watching the video. So the first thing we're going to do is check the area for danger. Check the area for danger. Hi, can you hear me? Wakey, wakey. Always trying to approach from their feet. Then I'll kneel down next to them and put pressure on their shoulders to see if they respond. No response. Help! Gonna open his airway. 1 hand on the forehead, 2 fingers on the chin. Do a chin lift and a head tilt. Then you're going to get nice and low so you can feel them breathing, see them and also hear them breathing. You're checking for 10 seconds. As soon as you realise I'm not breathing, you've got to give them 5 big bits of oxygen. Because normally a child and baby, the reason they're going into cardiac arrest is normally down to a problem with the oxygen, so asphyxiation of some sort. So open the airway again, pinch your nose and open your mouth over their mouth, getting a good seal. 1, look away, 2, 3, 4, 5. Remove the clothing and you're going to begin your compressions. Heel of the hand again is going to go in the centre of the chest, making sure your shoulder goes over the top, move your knees back, and you're pushing down 1/3 of their body depth, making sure you come back up again. Same as the adult idea, push and come back up. The same speed, 100 to 120 beats per minute. After you've done 30 of those at the correct speed, you go back to the airway, chin lift, head tilt, pinch your nose, keeping that airway open, and then do 2 breaths. Look away, and back on that chest again, doing your compressions. On a child and baby, we do 3 cycles, and if there's no one here to help us in between that time, and we're by ourselves, then we go and call the ambulance. And the reason we delay in calling the ambulance if we're by ourselves is because you can probably get them back to life. So we don't want to delay the treatment by running to find our phones. By all means, if your phone's in your back pocket, as soon as you know this person's not breathing, the quicker you get the ambulance there, the better. Just do not delay the treatment. Check the air for danger. Hi little one, are you okay? Can you hear me? Wakey wakey, rise and shine. Help! And the airway. Listen and feel for breathing for 10 seconds. 6, 7, 8, 9, 10. Not breathing. 1, 2, 3, 4, 5. 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2. I'm going to take baby with me while I go and make a phone call to the ambulance. So that was the whole thing you've just watched. So we're going to break it down to make it a little bit easier and simpler to follow. And this is when you can grab your cushion or teddy so you can practice as you're watching the video. So the first thing we're going to do is check the area for danger. Little one, are you okay? Wakey wakey, can you hear me? Help! Now on a baby we don't open the airway like we do on an adult and a child. A baby's airway is just neutral. It is not all the way back and it's not the forward, so it's just a neutral alignment. I'm going to get nice and low so I can feel, listen and also see their breaths. I'm going to check this for 10 seconds. Now a newborn baby is going to be breathing 10 times in those 10 seconds. This baby's not breathing, so I'm going to do 5 rescue breaths. Now when I do my rescue breaths, I must make sure my mouth goes over their mouth and nose, because my mouth is quite big. So, look away, look away, look away, look away, look away. 5 breaths. And they say it's a cheek full of air that we use. Cheek full of air. After that, remove the clothing, find these nipples, and we'll do, find these nipples and do compressions in line with the nipples, pushing down 1/3 of their body depth and going the same speed as a child and the adult. So 100 to 120 beats per minute, making sure when we push down, we come back up. 30 of those, now 2 rescue breaths. 1, 2, and then back on that chest again. Now, same as a child, we're going to do 3 cycles of 30 to 2. 28, 29, 30, 2 more breaths. 1, 2, last cycle. After this last cycle, we're then going to go and call the ambulance because they haven't come back to life and there's nobody else here to do that for me. Might even use 2 thumbs if I get tired. 1, 2. Right, let's go and get you to an ambulance. We're going to go and call an ambulance now. And then we come back and we carry on. An AED. AED stands for Automated External Defibrillator. Defib, shocky thing, whatever you want to call it. Now, one of the myths about an AED unit is that they start the heart. It's not true. What they actually do is provide a shock that interrupts the abnormal twitching of the heart, hopefully allowing the heart's own inbuilt pacemaker to sort out the rhythm, reboot itself and kick back in again. Bit like when you've got an issue with your phone or your computer, you reboot it. That's kind of what the AED does to your heart. Now, the need for CPR does not always mean that the heart has stopped, because it's got electrical activity within the heart that it will quiver. So rather than beating like this or stopping like that, a heart could quiver. And if it's quivering, a bit like a jelly on a plate, it won't have a pulse. Now, when using an AED, There are shockable rhythms, normally called VF and VT. And then there are non-shockable rhythms, for example, when the heart is beating normally, like mine is right now, or when there is no electrical activity at all and it just flatlines. Now, to use an AED effectively, you don't need to worry about it because the AED will detect what type of rhythm the casualty has and it will tell you whether to shock or not. But it is vital to get the AED to the patient as soon as possible. So as soon as you know they're not breathing, ideally you need to get an AED there straight away. And to carry out effective CPR until that AED arrives. That's where the helper comes in. Now, early defibrillation is a vital link in that chain of survival we talked about in a few videos ago. And every second counts. So we're doing CPR on the casualty, waiting for that AED to arrive. Because the sooner the AED arrives, the better that person has of recovering. Now, as soon as an AED is given to you, turn it on and use it. It will talk to you and tell you what to do. And the next couple of videos will show you how to do that. Now, there are a lot of different types of AEDs on the market. They're all a little bit different, but they all do the same thing. They all have a set of pads you have to put onto a patient. They will all have an on and off button, and they will all talk to you as well as have a visual prompt so you can see what it's telling you to do or see what's going on. Now, as soon as you get one, turn it on and follow those instructions. It will talk to you. There's normally an accessory kit that comes alongside it. So scissors, a towel and a razor. The scissors are designed to remove clothing. So you'll cut my t-shirt off going away from my face. You don't want to make it slip and make it worse. The towel will be used to dry the casualty, and the razor is used to get rid of any hair where you want to put the pads, because otherwise they will just sit and float in the air rather than actually stick to the skin surface area. So as soon as you get one, use it. Now, you might be thinking, where do I find one? Well, there are lots around at the moment. I'm going to give you a task. I want you to find where your nearest one is. Does your workplace have them? Common places you're going to find them are all leisure centres would have them. Some sports clubs. You'll find quite a lot of schools, dentists, doctors, big shopping centres, big supermarkets, some railway stations. But have a look and see if you can find your local one, your nearest one for your workplace, and the nearest one is for your home. See if you know where yours is, because you need to get it without a delay. If your workplace has one, always make sure you use it. It's not a wall decoration. Don't just leave it sitting on the wall. Make sure you use it on that casualty. So the next videos are going to show you how we use it on an adult casualty, and also how to use it on a child casualty or someone of a smaller frame. But always remember, if you know your casualty is not breathing, you need to call the ambulance. You need to get an AED there quickly, you need to begin CPR, and then you need to get to hospital. Now, paediatric CPR, ideally that you want to follow that chain of survival, but if you're by yourself, you wait for a minute before you go and get that AED. Now let's talk about how to use an AED, because hundreds of people are alive today entirely due to the prompt and appropriate use of a defibrillator. For every minute's delay in deploying a defibrillator, the odds of survival reduced by about 10%. So in this video, we're going to look at adult CPR as a sole rescuer, meaning you're the only one there, but you've got an AED located nearby. And we're going to remember the acronym from previous videos, our primary survey. Danger, response, airway and breathing. They're not going to be breathing, so then we must make sure we activate the EMS, we do CPR, and we get a defibrillator to them. And that was all part of the chain of survival we talked earlier about. Early access or the activation of the emergency medical services, beginning CPR, getting a defib to them, an AED, and then early advanced care. And if we can do all that in a timely manner, the chances of survival are hugely increased for this casualty. Okay, so the first thing we're going to do is D for danger. We're looking, we're listening, we're smelling for things that could be dangerous. We're approaching the casualty from the feet, and we're making sure that we talk to them. We ask their consent. Hi, my name is Emily, I'm a first aid, I'm here to help you. We'll see if they respond, we'll give them a bit of pressure on their shoulders, and maybe make a loud noise to see if they respond. There is no response. So then I do A for airway. I open the airway with a chin lift and a head tilt. and then I look, listen and feel for breathing for up to 10 seconds. So I'm looking at their chest rising and falling, I'm listening with my ear, and I'm trying to feel for breath on my cheek. Now this casualty is not breathing. So I leave the casualty now, and I go and call the emergency medical services, and I make sure I grab the AED, because there's one easily located that I can get in a few minutes. I return with the AED. The first thing I do is open it up and turn it on, because it's going to talk to me. It's going to tell me exactly what to do. I'm then going to make sure I'm wearing the correct PPE. So I'm going to get my gloves on in this case. I'm then going to follow the instructions.
Apply pads to patient's bare chest.
The first thing I need to do is have a naked chest. So I need to remove the clothing off this casualty. So I'm going to unzip the jacket, and then I'm going to use the scissors and place a cut at the top of the t-shirt. Might try and rip it. If that doesn't work, I will then keep cutting all the way down. Remember, neck down to belly. I'll make sure that they're not hairy, and if they were hairy, I need to shave them where the pads would go, and maybe dry them if they're very clammy or sweaty. I'll get the pads out of the packet. I will have a look at the pictures on the pads, because they do show you where you need to put them. Unpeel them, because they're a bit like plasters. Stick one on underneath the right clavicle, and the other one underneath the left pectoral muscle. There should be a hand's width distance apart between the pads.
Plug in pads connector next to flashing light.
You will then plug it in to where it's flashing, and you follow the rest of the instructions.
Analyzing heart rhythm. Do not touch the patient.
Making sure that everyone's standing back, nobody's touching a casualty, because if someone is touching them, reading will be incorrect. It will analyse your reading rather than the casualty's reading. Now remember, it's looking for a shockable rhythm.
Shock advised. Charging. Stay clear of patient.
Tell everyone to stay back, so I say clear.
Deliver shock now. Press the orange button now. Shock delivered. Start CPR.
Then begin CPR. So I'm doing 30 compressions with 2 rescue breaths. When the shock's been given, you continue with CPR as directed by the machine, and you keep going with 30 compressions to 2 rescue breaths. The machine will reassess the heart rhythm, normally every 2 minutes, and they'll advise another shock if indicated, or they might say no shock advised. Please, if it says no shock advised, just continue with CPR and follow the prompts. Keep going until help arrives. And only stop CPR if the casualty begins to regain consciousness, or until you become too tired, you can't carry on and there's no one else there to take over from you. Let's talk about what we'd do then if there was a helper there with us. What would we do? Well, quite simply, one person will begin the CPR straight away, because remember we talked about that being really important in the chain of survival, while the other person goes and calls the EMS, and then they will make sure they grab the AED. When that person comes back, they will take over the AED while you carry on with compressions. Now you've just seen me perform CPR using an AED with an adult. Now let's have a look at how to use it with a child. We're going to do it as if we're by ourselves first of all, then we'll talk about what we would do if we had helpers there with us. So we're going to do the same primary survey. We're going to check the area for danger. We're going to check for response. We're going to see if they respond by pressure, by talking to us, make a loud noise next to them to see if they wake up. No response, I'll probably shout for help. I will then open the airway by doing a head tilt and a chin lift, and I will look, listen and feel for breathing, normal breathing in 10 seconds. This casualty is not breathing, so because it's a child, I'm going to do 5 rescue breaths. After my 5 rescue breaths, I will then do compressions using the heel of one hand. Now I've got no scissors with me, so I'm just going to remove the casualty's jacket because I can unzip that, and do compressions with the heel of one hand, 30 of those at the speed of 100 to 120 beats per minute. And then I will go and do 2 rescue breaths. And I'm going to do that 3 times, 3 cycles, which is 1 minute. After a minute, if this casualty hasn't woken up and I'm still by myself, I'm going to leave them to go and make a phone call and to grab the AED that I have available. I will come back and I will turn the AED on.
Apply pads to patient's bare chest.
I'm putting my gloves on, my PPE, and then I'm going to get the scissors and cut their t-shirt off so I've got a naked chest. I will then put the pads on. Now this is a bit that's different. On a child, we place the pads front and back. If you remember, on an adult, we had them on the clavicle, the collarbone, and on the left-hand side of the body. So the shock will go through the heart. We can't put them like that on this child because their frame is too small. And that will mean the shock will go over the heart rather than through it. So we're going to place one on the front of this child, and then we're going to place one on the back, so the shock will go through the heart. When the pads are in place, we're going to plug it in and listen to the instructions.
Analyzing heart rhythm. Do not touch the patient.
So it's looking for a shockable rhythm, so we're making sure we're not touching the casualty as it's doing that.
Shock advised. Charging. Stay clear of patient.
Now as it's charging, we're making sure everyone is standing back. We're getting ready to push that shock button when it flashes. We're then going to push that button when it tells us to. And afterwards, we're then going to carry on with our 30 compressions and 2 rescue breaths. Now if I had a helper there with me, we do not delay in calling the emergency medical services. If there's a helper there, we know this person is not breathing, this child's not breathing, we send them to go and get an ambulance straight away and come back with that AED. So I just want to finish off the CPR section with some questions that people normally ask me on my face-to-face courses. Now the first question that I always get asked is, do I have to put my mouth on theirs? Because they're normally concerned about infection. And rightly so, especially in the current climate. So the answer is yes and no. It all really depends on the casualty you've got in front of you. So if you're working with adults, the guidelines since 2015 have stated if you're unable and unwilling to give rescue breaths, then please do something. And that something will be compressions and compressions only. Because something is better than staring at them. If you stare at a casualty, they are not going to come back to life. You attempting to do compressions is better than doing nothing at all. Now with a child, to someone under 18 or a drowning casualty, those 5 initial rescue breaths are really important. Remember what we said previously, that a child and a drowning casualty, the reason the heart has stopped is not a problem with the heart, is because it's a problem with oxygen. And they need the oxygen. So it's quite important that we give them oxygen. So make sure we do have a face shield or a pocket mask or some type of barrier between you and them to prevent infection, and attempt to give up to 5 rescue breaths. And then 30 compression and 2 rescue breaths. So for a child and a drowning casualty, so anyone under 18 and anyone that's suspected to be drowning, rescue breaths are very, very important. Next question I get asked is, what happens if the casualty is sick? Well, if the casualty is sick, we just need to turn them over on their side, make sure they're not choking on their vomit, wait for them to finish being sick, roll them back again, check to see if they're breathing, because if they are breathing, great, but if they're not, we need to carry on with CPR. And of course, I would encourage you to use a face shield as well. Now, another question would be, my rescue breaths are not working. I don't see the chest rise and falling. Now remember we said we need to see a gentle rise and fall of the chest, but you've got to make sure you open the airway. So if you don't see that gentle rise and fall of the chest, maybe the airway is not open, maybe you haven't got a good seal. So make sure you fully open the airway, it should be fully extended here at the neck. Make sure you're pinching their nose or you're covering their nose, depending on what casualty you've got in front of you. And make sure you've got a good seal around their mouth. Now, if it still doesn't work, there might be another reason. They might have a blockage that's out of your control. But make sure you've opened the airway and make sure you've got a good seal. And we're only going to attempt 5 initial for a child or a drowning casualty. Then after that, we're only attempting 2. Then I always get asked, how do I know I'm going deep enough? I don't want to hurt them. Well, listen, this casualty is not breathing. You've got to do something to them. And my advice to you would be, go hard. Because if you don't go hard enough, all you are doing is tickling them. But a good tip to see if you are actually being effective with your compressions would be colour. You should hopefully see the colour coming back to their face if you're going deep enough with a compression, because at the end of the day, you're pumping the heart, which is pumping blood around the body, which has got oxygen in there, so you should see colour coming back up to their face. And it doesn't matter what colour skin someone's got, we've all got nice red rosy lips, so you should see colour coming back to their lips and back to their face as well. And then finally, the question I get asked is, I'm tired, when can I stop? Of course, you can stop CPR if your life is being affected. For example, preserve life. It's your life as well. Even if you just have a little rest, I'd probably, if I had to stop, run out of my workplace, my home, wherever I am, and scream for someone else to come and help me so they can take over. And if there's a helper there, they should be taking it in turns with me. One person does something, the other person rests, and keep going like that. But you would stop if you're by yourself, if you can't carry on anymore. If the casualty comes back to life, please do stop then. If the ambulance turn up, or someone else of course takes over from you, then you would stop them. When to call an ambulance. You would have noticed that I called an ambulance at a different time, whether it was an adult casualty in front of me or whether it's a paediatric casualty in front of me. And I want to explain the reason behind that. Now, if you come across an adult that's collapsed in front of you, it is vital that the helpers go and check their breathing straight away. It is then vital to make sure that if we know they're not breathing, that actually we call the emergency medical services as soon as we know they're not breathing. Because if you've not called for help, delivering CPR to that casualty without the ambulance coming and without the use of an AED will not help them at all. If I am there by myself with that patient, then I must leave them to call the ambulance myself and bring the phone back and stick it on speakerphone. I'm not going to go off looking for an AED unless I know I can get one there in a few minutes, but I'm not going to go looking for one, I'm going to be 10 minutes away because the EMS will bring one. Now, if there is a helper there with yourself, one person should be doing CPR because obviously the earlier we start CPR the better, but at the same time we need to make sure the ambulance is coming. So we need to make sure the helper goes off and calls the ambulance and if possible goes and finds an AED. That will greatly increase the chance of survival. And the reason why that increases the chance of survival is because an adult is more likely to suffer from a heart problem, therefore they need drugs and defibrillation in order to be able to get that heart working again. So we must leave to get that qualified help before we then begin CPR, unless of course somebody's there with us while we do CPR and they get help. Now with children, so anyone under 18 or victims of drowning, if there's only one rescuer, then we need to make sure that we start resuscitation for 1 minute before going for assistance. So you notice we did 5 rescue breaths in the video, then we did 30 to 2 for 1 minute before we then go and get assistance. Now the reason we delay calling EMS on a child and a drowning victim is because their heart has normally stopped due to a problem with oxygen. So we need to give them some oxygen, our 5 breaths, pump it around the body for a little bit, and then hopefully within that first minute, which is really important, they will come back to life. And if they don't, obviously we're then going to go and call the EMS, the emergency medical services. Now, if there is a helper there with yourself, one person should be doing CPR, because obviously the earlier we start CPR the better, while the other person goes and calls the ambulance. There's no need to wait for 1 minute if there's more than one helper. Now the only exception to performing 1 minute of CPR before going for help is if there is an unlikely event that it's a child with maybe a sudden collapse, witness sudden collapse. And therefore we will be assuming it is a problem with the heart. In that case, we seek help immediately if there's no one to go for you. Thank you so much for listening. Hope you've enjoyed the training. Don't forget we've also got lots of e-learning courses and I'll leave the links for them available below. And please don't forget to hit subscribe as well.